An unexpected hospitalization can be scary, aggravating, and overwhelmingly expensive. I'm Joe Leppert, and I've been in the healthcare industry for 11 years, and I've seen what happens to patients when they've been in the system. I'm here today to try to help you get out of the healthcare system as quickly as possible without an HAI, a healthcare acquired infection, and with as minimal impact to your pocketbook as possible. The first line of defense is to go to the right place for the right thing. This is called a triage. To triage yourself, I'd like you to ask, what kind of injury do I have? If you have a mild ailment or pain, it's a good idea to go see your primary care physician, as they have access to your medical record and all of your history and physicals so they can better diagnose you. In the event that you happen to have a sprain, a non-compound fracture, or a more acute injury, it's best to go see an urgent care clinic. This will also help alleviate some of the saturation in the emergency rooms. If in the event you have a life-threatening emergency, it's a great idea to get to an emergency room via an ambulance as quickly as possible. If an ambulance is unavailable, please feel free to use any reliable mode of transportation and have someone take you there. Now, there are three different things that can happen if your healthcare professional suggests that you need hospitalization. They can send you to a short-term acute care hospital, which has a 2 to 5 day length of stay and has a moderate degree of healthcare acquired infection rate. And most of your expenses will be covered by your insurance provider. However, there are cases where you're going to need a little bit more of an extended stay, and you may elect to go to a long-term acute care hospital. If you do, those have a 25 to 30 day length of stay with a slightly higher risk of hospital-acquired infections and are not covered under most insurances until after your out-of-pocket or deductible have been met. The last line of defense is a skilled nursing facility or a SNF. These have a 275 day length of stay average or 9 months, where most insurance providers only pay for about 4 months of these after your out-of-pocket and deductible have been met. These also have the greatest risk for hospital-acquired infections. Now, you'll notice in each of the three previous examples that I illustrated hospital-acquired infections. I'd like to touch base on those and what they can mean to you. Oh, well, that's unfortunate. According to approaches for preventing healthcare-associated infections, infections are everywhere. They reside in close communities with a varying degree of ailments and can sometimes be passed from one person to the other. A compendium of strategies to prevent healthcare-associated infections in acute care hospitals mentions that bloodstream infections are the highest rated at risk for the hospital-acquired infections. However, the most common are urinary tract infections, respiratory infections, and digestive infections. As you can clearly see, having an additional infection on top of your already prevailing ailment could cause a longer hospital stay and undoubtedly more money. So, how can we reduce the risk of acquiring a hospital infection? One of the largest ways is to make sure that you triage yourself, as previously mentioned. Another way is to have a clean environment. You want to make sure that your healthcare professionals are cleaning your room and yourself as frequently as you see fit. Another way is making sure that you have appropriate hand hygiene. As strategies to prevent healthcare-associated infections through hand hygiene has mentioned, this is your number one defense against any HAI. Feel free to ask your healthcare professionals if they have washed their hands. The ethics of empowering patients as partners in healthcare-associated infection prevention says you, as the patient, have a right to know if your healthcare professional is doing what they need to. Finally, the CDC recommends that in the event that your healthcare professionals see that you need a line placed inside of your body, make sure that you have exhausted all other options first, as lines inexplicably increase your chances for acquiring a hospital infection. So after all of this has been said and done, it's time for you to discharge. But ideally, we need to make sure that you're doing your part to get there. In order to discharge, you need to be proactive. Make sure that you're taking part in your therapies and your recovery. Be sure that you have a contact person at the facility, whether it is a case manager or an ambassador, that you can communicate with on a regular basis. Make sure that you're honest about your care, as certain uncertainties, modes of patient safety in healthcare has suggested patients who are dishonest often wind up getting mistreated or wrongly treated for ailments that they may not or may have had. And ask about your discharge daily. Make sure that you're keeping in contact with your nurses and your case manager and inquire, what is my discharge plan? What do I look like for tomorrow? So that way they know that you're eager to get out of the healthcare continuum. Well, now that you know how to triage your ailments, how to narrowly avoid a hospital-acquired infection, and how to get out of the healthcare continuum as quickly as possible, I encourage you to find the facilities in your area that will better suit your needs, as you can always suggest where you would like to be treated. The only event that does not apply is in the event of an extreme emergency where you have to be taken to the nearest facility to manage your needs. Again, my name is Joe Leppert, and I thank you for helping your healthcare professionals help you.